Hello everyone, and thank you for joining us today for this insightful session on dorsal root ganglion stimulation, specifically tailored for advanced practice providers by Nurse Practitioner Briana Damora, a Doctor of Nursing candidate at Wagner College. Together we can bridge the gap in managing chronic pain. Let's briefly go over objectives for this session. Define DRG dorsal root ganglion stimulation. Explain the indications for DRG. Discuss patient selection criteria for DRG. Explore a model for bridging the gap between primary care and pain management. Review the clinical evidence supporting DRG. By the end of this session, you will be better equipped to determine the best patients for DRG stimulation and enhance care for patients with chronic pain. DRG stimulation therapy works by stimulating dorsal root ganglia. These are structures along the spinal column made up of densely populated sensory nerves, and they act like traffic lights, regulating signals and sensations that travel through nerve fibers along the spinal column to the brain. They carry sensory messages from various receptors at the periphery toward the central nervous system for a response. DRG stimulation therapy involves surgically placing a stimulator that targets the dorsal root ganglion to relieve pain. This includes a generator, a small device that sends out mild electrical pulses and that contains a battery. This is implanted in the patient's body. Then there are the leads, which are thin insulated wires that carry the electrical pulses from the generator to the dorsal root ganglia. There is also a patient controller, a handheld remote control that allows you to adjust the strength and location of stimulation or even turn stimulation off. There is a 7-day trial phase that closely mimics the implantable system. A temporary device, which includes temporary leads, are connected to a small external battery worn outside of the body, typically on the low back. This typically lasts 1 week. If the trial is successful, a permanent device will be implanted under the skin. Let's briefly highlight how DRG overcomes the limitations of traditional spinal cord stimulation. DRG targets the dorsal root ganglion, allowing for more precise pain relief for specific areas, unlike the broader stimulation of traditional SES. DRG is particularly effective for neuropathic pain conditions like complex regional pain syndrome, offering better outcomes where traditional SES may fall short. DRG provides pain relief without the uncomfortable tingling sensations often associated with traditional SES, enhancing patient comfort. Also, the DRG systems typically require less energy, leading to longer battery life and fewer replacement surgeries. Additionally, DRG allows for customizable programming, enabling tailored treatment based on individual patient needs. Lastly, many patients report greater satisfaction with DRG stimulation. The combination of targeted pain relief, reduced side effects, and effective management contributes to an overall improved quality of life. DRG therapy has been proven effective for neuropathic pain after surgical procedures, also known as causalgia or complex regional pain syndrome type 2. This includes hernia repairs, total knee and hip replacements, foot and ankle surgery, pelvic pain after surgery or trauma, lower extremity amputations, causalgia from a traumatic injury of the hip, knee, ankle, or foot, and also complex regional pain syndrome type 1 of lower extremity, as well as chronic low back pain and diabetic neuropathy. Let's discuss the types of complex regional pain syndrome. CRPS type 1 is characterized by extreme pain out of proportion to the original injury with evidence of allodynion hyperalgesia. Causalgia, or CRPS 2, is severe pain due to an injury to a named peripheral nerve. Think about the patients you treat in your practice. Would any of them be a candidate for DRG? Who are the best patients for DRG? Patient whose pain is 24/7 and neuropathic. Pain is not primarily mechanical. They have tried conservative therapies and failed. They would not benefit from additional surgery. The risks outweigh the potential benefits. They have passed a psychological evaluation. They do not have untreated depression or drug addiction, and they have no medical conditions that would keep them from undergoing implantation. Let's go over 2 case studies. Our patient is a 50-year-old male who has undergone several lumbar spine surgeries, including laminectomy, discectomy, and spinal fusion. Despite these interventions, he has been experiencing persistent chronic back pain, primarily localized in the lower back and radiating to the left leg. He rates his pain severity between 6 and 8 out of 10 on the numeric rating scale. This pain intensifies with prolonged sitting and physical activity, greatly affecting his daily life and functionality. Our approach began with conservative management strategies. The patient underwent 6 months of physical therapy, but unfortunately, this yielded minimal improvement. He was also placed on a regimen of medications, including NSAIDs and opioids, which provided limited relief and resulted in undesirable side effects. Additionally, he received several epidural steroid injections, which offered only temporary relief. Given the complexity of his case and the failure of conventional treatments, we decided to explore advanced options, specifically DRG. By day 7 of the trial, he reported significant pain relief, with his pain level reducing to 3 out of 10. This positive response led us to move forward with a permanent DRG implant. Now, let's discuss the outcomes. At the 6-month follow-up post-implantation, our patient reported a pain level of just 2 out of 10 for his lower back pain. More importantly, he noted a substantial improvement in his overall functionality and quality of life. Additionally, he successfully weaned off multiple medications, including opioids and NSAIDs. In conclusion, this case illustrates the potential effectiveness of DRG in managing chronic back pain, particularly in patients with complex histories like ours. Our next case involves a 34-year-old male patient with a complex history of pain management related to his right lower extremity. Our patient is a 34-year-old male who has undergone 2 surgeries on his right ankle. The first surgery involved an ankle fusion, followed by a second procedure for hardware removal. Unfortunately, these surgeries led to a significant complication. The patient was diagnosed with complex regional pain syndrome type 2, also known as causalgia, in his right lower extremity. The symptoms he experienced were quite debilitating. He reported persistent pain, which he rated as high as 10 out of 10. Additionally, he had swelling, noticeable color changes in the affected limb, numbness, and hypersensitivity to light touch. These symptoms severely restricted his daily activities and quality of life. In terms of prior treatments, our patient had undergone an extensive regimen. He received 12 lumbar sympathetic blocks, which unfortunately did not provide lasting relief. He also tried peripheral nerve blocks and even underwent a spinal cord stimulation trial, but this too failed to help alleviate his pain. Recognizing the complexity of his CRPS and the ineffectiveness of previous interventions, we decided to explore dorsal root ganglion stimulation. We proceeded with a DRG trial. The results of the trial were quite promising. The patient experienced an impressive 80% reduction in his pain levels. Specifically, his foot pain decreased from 10 out of 10 to just 2 out of 10. Moreover, we observed improvements in his range of motion, a decrease in medication usage, and most importantly, he was able to return to work. This case underscores the potential of DRG in managing complex pain syndromes like CRPS when traditional treatments fail. The collaboration between primary care advanced practice providers and pain management advanced practice providers is essential for the effective management of patients undergoing dorsal root ganglion DRG stimulation. Here's a framework for a collaborative care model focused on DRG. First, primary care advanced practice providers should actively screen patients using standardized tools to assess pain levels, treatment history, and overall suitability for DRG. Once candidates are identified, primary care advanced practice providers must refer them promptly to pain management specialists. Establishing clear referral pathways ensures that patients receive specialized care without unnecessary delays. Effective communication is vital. Primary care advanced practice providers should share relevant medical history and diagnostic information with pain management advanced practice providers. Additionally, obtaining medical clearance ensures that any potential risks are assessed before proceeding with the procedure. In summary, this collaborative model focuses on timely identification, referral, and communication between primary care and pain management specialists. Together, we can optimize treatment for patients with chronic pain and enhance patient outcomes. Let's discuss the clinical evidence. DRG therapy is supported by the ACCURATE study, which stands as the largest randomized, controlled trial in the realm of neuromodulation for focal chronic pain. The findings from this study reveal remarkable improvements in quality of life and other positive outcomes at the 12-month mark. An impressive average pain reduction of 81.4%, a remarkable 86% of patients experienced sustained pain relief, over 80% of patients reported significant pain relief. These results highlight the efficacy of DRG therapy in transforming the lives of those suffering from chronic pain. In conclusion, the innovative approach of dorsal root ganglion stimulations represents a transformative shift in healthcare, uniting primary care and pain management to empower lives and ease suffering. By fostering collaboration among healthcare providers, patients, and communities, we create a compassionate system that prioritizes healing. Together, we heal, and together, we can change lives for the better. As we wrap up the presentation, I would like to remind everyone to please take a moment to return to SurveyMonkey and complete the post-tests. Please feel free to reach out if you have any questions. Thank you for your participation.